Hi friends, now we will discuss about the osteology of fibula. As I already told you, fibula is the medial bone of the leg. It is a post-axial bone and is similar to the ulna of the forearm. As you can see here, fibula is not a part of knee joint. It only forms the part of the ankle joint, lower end of fibula. Here you can see it is expanded as a lateral malleolus, which lies 1 centimeter below than the medial malleolus. You can see here it lies 1 centimeter below than the medial malleolus. And if you isolate the fibula, it's a long bone. Like any other long bone, it has a upper end, lower end and an intervening shaft. When you see the upper end is presents three parts here that you can observe. It presents an articular facet for the lateral condyle of the tibia, the lateral surface of lateral condyle of tibia to form superior tibial-fibular joint, and it also presents a projection posterior-superior that is called as styloid process and a sloping surface in front of this styloid process. So one is articular facet, two is this styloid process, and three is sloping surface in front of the styloid process. This is the upper end, and just below upper end you can see a constricted part, that is neck. That is the neck. Here the common peroneal nerve will divide into superficial and deep peroneal nerve. So any damage to the neck of the fibula will cause foot drop, as the extensor muscles will be paralyzed, because the extensor muscles are supported by deep peroneal nerve, whereas the peroneal muscles are supported by superficial peroneal nerve. I already told you superficial peroneal nerve is a muscular cutaneous nerve of the lower limb. Then come to shaft. Shaft is roughly triangular, presents three borders that you can see here. It presents three borders. This is the anterior border here, which is sharp, and it expands in the lower half to a triangular area over the lateral surface of lateral malleolus, whereas the medial border is here. Medial border is sharp. This is the medial border. Here you can see. This is the anterior border here, beginning just below the styloid process here. This is the sharp medial border or interosseous border, and posteriorly you have a not so significant posterior border. Here you can see the posterior border. So three borders and three surfaces. So between the medial and anterior you can see this extensor surface. This is the medial surface, or also called as extensor surface. Then here is the lateral surface or peroneal surface. It gives origin to peroneus muscle, and here is the posterior surface. Posterior surface is divided into two areas by a median crest, by a concave area here. It has a concave area here and a median crest here. So it has an anterior concave part and a posterior flat part. Again, that is divided by a median crest here into middle and lateral parts. That is the posterior surface of the shaft. Coming to this extensor surface of the shaft, here it will give attachment to three muscles. In the upper 3/4 it gives attachment to extensor diastrom longus. In the middle 2/4 it gives attachment to extensor hallucis longus, and in lower 1/4 it gives attachment to peroneus tertius. So upper 3/4 of the medial surface or extensor surface of the fibula gives attachment to extensor digitorum, middle 2/4 to extensor hallucis longus, lower 1/4 to peroneus tertius. Whereas the lateral surface, you can see here, lateral surface, the upper 2/3 will give attachment to peroneus longus, lower 2/3 to the peroneus brevis. So it is called as peroneal surface or the lateral surface. Whereas the both anterior and posterior borders of the fibula give attachment to anterior and posterior intermuscular septa, which divides the leg into three compartments, as we already discussed. in the previous classes. Then coming to the posterior surface of the fibula, as I already told you, it has a anterior concave area and a posterior flat area, and from the posterior surface here, anterior to this concave area, there is a origin of tibialis anterior, whereas the remaining part, there is a origin of soleus here, and it is divided into two areas by a median crest. The medial area will give attachment to tibialis posterior here, including this concave area. Sorry, this is tibialis posterior, whereas the remaining part will give attachment to the flexor hallucis longus muscle, which is similar to flexor pollicis longus of the upper limb. Here you can see anterior concave area gives attachment to tibialis posterior, and this area here to the soleus. This is soleus, and remaining part, the lateral part of the posterior surface gives attachment to flexor hallucis longus, whereas medial part of the posterior surface of the shaft of fibula gives attachment to tibialis posterior. Then coming to the lower end, that you can see here, coming to the lower end, you can see lower end presents the 5 surfaces. It presents an anterior border here. You can see it presents an anterior border which gives attachment to superior extensor retinaculum, and also the anterior talofibular ligament, whereas the lateral surface, which is formed by the splitting of the anterior border, which is triangular, and this tip will give attachment to calcaneofibular ligament, whereas this lateral surface is subcutaneous. It is felt as a lateral malleolus, whereas posterior surface is grooved by tendons of peroneus longus and peroneus brevis, and they are held by superior peroneal retinaculum, which is attached to the posterior border here. Posterior border in its entire extent gives attachment to the posterior intermuscular septum, whereas the medial surface of the lower end of fibula here presents an articular surface, but here it presents a malleolar fossa. This non-articular malleolar fossa is inferior, medial and posterior. Important, remember as important. It is inferior, it is medial and posterior. So IMP, this is the point, this is the clinching point to identify the side of the fibula. Usually the posterior surface presents too many concave areas, ridges and flattened areas. It is difficult to identify the fibula. This malleolar fossa in the lower end of it is present in the lower end of fibula. It is inferior, medial and posterior, and it helps you to identify the side of the fibula. So remaining articular part will articulate with the fibular notch of the tibia to form inferior tibiofibular joint. So these are the attachments. Then you can see, coming to the ossification, the upper end of fibula, the center for ossification of the upper end starts between the 3 to 4 years. It starts between 3 to 4 years and fuse by 17 to 19 years. Whereas for the lower end, for the center for the lower end appears between 1 to 2 years and finish by 15 to 17 years. That means fibula violates the law of ossification. It appears early and fuses early. According to law of ossification, the center which appears first, it fuses last. But here the fibula violates the law of ossification, because upper end of this fibula is traction epiphysis formed by the pull of the tendon of biceps femoris, whereas the lower end of fibula is pressure epiphysis. So according to one more law of ossification, pressure epiphysis fuses earlier than the traction epiphysis. That's why lower end of fibula violates the law of ossification, because lower end is pressure epiphysis, upper end is traction, and according to one more law, pressure epiphysis will fuse early than the traction epiphysis. That's why lower end center appears early, fuses early, whereas for the shaft it appears around 8th week. 8th week of the intrauterine life. So this is about the osteology of fibula. Coming to the attachments here, you can see the attachment of the intramuscular septum to the anterior border and also posterior border of the tibia. Here it forms a anterior and posterior intimus septa, and to the upper end of tibia you can see there is the attachment of this fibular collateral ligament to the stellar process, and also the arcuate popliteal ligament is attached there to the upper end or stellar process of the shaft of the fibula. In the lower end you can see the anterior border gives attachment to this superior extensor retinaculum, and the tip of the lateral malleus gives attachment to this superior peroneal retinaculum and also to the calcaneofibular ligaments. You can see here anterior talofibular ligament to the anterior border of lateral malleolus, and posterior here you can see posterior tibiofibular ligament and also the posterior transverse talofibular ligament that you can appreciate here. Here you can see calcaneofibular ligament, the tip of the lateral malleus. Here you can see 3 ligaments to the anterior border, anterior talofibular ligament to the medial part of the lateral malleolus. You can see posterior talofibular ligament, and to the tip of the lateral malleus there is calcaneofibular ligament is attached. And you can see here that to the entire medial surface there is attachment of this interosseous membrane. Coming to the muscular attachments, you can see upper 3/4 of the extensor surface gives attachment to extensor digitorum longus, then medial 2/4 to the extensor hallucis longus, and lower 1/4 that you can see here gives attachment to peroneus tertius, whereas the lateral surface upper 2/3 to the peroneus longus, whereas lower 2/3 that you can see here gives attachment to peroneus brevis. Posterior surface you can see here, if you remove this gastrocnemius muscle, here you can see soleus taking origin from the posterior part of the head of the fibula, and also upper 3/4 of the posterior surface of the shaft of fibula. Here you can see, whereas the anterior concave part gives attachment to this tibialis posterior medially and laterally to the flexor hallucis longus that you can see here. These are the muscular attachments of the fibula. And here you can see one more thing. Here you can see the tendon of biceps femoris attached to the stellate process of the upper end of fibula. This completes the osteology of fibula. Thank you.